Hey there, welcome back to GrowMed. So if you're new to GrowMed, subscribe to GrowMed and tap the bell icon so that you do not miss any regular study tips. So in this video, we will discuss about the ENT one-liners, the important one-liners asked in the past years. So I've collected all those from the past years and provided you in a easier manner so that in the last minute you'll be watching this video and recalling a lot of things. So already I have uploaded on a lot of subjects, so you can have a look in my Telegram channel, and the other things also are there. Okay, so let's get into the video now. So the first question: only abductor of the vocal cord, and it is the posterior cricoarytenoid muscle. The narrowest part of the infant larynx, it is the subglottis, and in case of adult it is the glottis in case of adult. Then rhinoscleroma is caused by, so the causative organism is the rhinoscleromatis. Then the next question, so merciful anosmia, this is a feature of atopic rhinitis. Atopic rhinitis, again a repeat topic. Atopic rhinitis, so again a repeat topic, and frequently questions are asked on this one, that what the treatment, then the case, then the management, and all these things. Okay, so the next question is also on the atopic rhinitis treatment of choice, and it is the modified Young's operation. The drug of choice for the mucormycosis, favorite question and as well as a repeat topic, so I think you already know about this. That is liposomal amphotericin B. Liposomal amphotericin B, the drug of choice for the mucormycosis. Then most common complication of the CSOM, that is serous cystic otitis media, and it is the acute mastoiditis. Then the next question, sensory nerve that supplies the larynx above the vocal cord, so it is the internal laryngeal nerve which will be supplying the vocal cords above larynx above the vocal cords. Then what is the function of the utricle and the saccule? So it will be controlling the linear motion. The utricle will be controlling the linear motion, and the saccule will be controlling the angular motion. Okay, so angular motion and the linear motion. Then like ramal sac is present in which part of the orbit? So it is the medial wall of the orbit. Then Ramsay-Hunt syndrome, which ganglion is affected? So it is the geniculate ganglion which is affected in this disease, and this is also a repeat topic. Ramsay-Hunt syndrome. Anterior ethmoidal air cell is Agarnase. Anterior most ethmoidal cell, Agarnase. Okay. Then target sign on the filter paper is seen in which disease? So it is seen in case of traumatic CSF leak, and if you have already solved the PYQs and if you have read about it, then you will be able to get the image of this one target sign in your head, because image based question has also been asked on this CSF traumatic leak, that the target sign or the halo sign, this sign is associated with which disease, or identify the sign. So yes, image based question, important one. Then they had asked the question on this Bill's bar. What is this Bill's bar? So it is a vertical bony septum in the internal acoustic meatus. Okay, then membrane that forms the upper part of the tympanic membrane, it is the Sharpnell's membrane. So the best management of the traumatic ear perforation is the conservative management. So it will be filling up by itself. So it's better that we will leave it on its own to patch up. So conservative management we will be doing for this traumatic ear perforation. The most common cause of malignant otitis externa. So it is the pseudomonas. And the next question, treatment of choice for the nasopharyngeal cancer. Nasopharyngeal carcinoma, again a repeat topic. You can surely expect one question from this in the exam. So the treatment of choice is the chemo, radiation, and sometimes the question is also asked on this one, that what is the most common symptom? So the next question, the most common clinical feature. So it is the cervical lymphadenopathy. The next question, in which meatus of nose surgical opening of the DCR is made? So it is the inferior meatus. Then the next question, so PTA, in the pure tone audiometry, the notch is present at the 400 hertz in the air conduction and the bone conduction. So what will be the cause? And it is the noise induced hearing loss. Then the next question, so Picket fever is associated with lateral sinus thrombosis. Then muscle, which is used for the opening of the eustachian tube, it is the tensor valli pallati. Then office headache is seen with which sinusitis? So it is the frontal sinusitis. Whenever there's infection of this frontal sinus, you can see this office headache. Etiology of the nasopharyngeal carcinoma. So it is the Epstein-Barr virus. A famous question. Okay, so nasopharyngeal carcinoma, we have already discussed like 3 important questions. Okay, so these were some important one-liners asked in the past years, and surely you can expect some 2 or 3 questions coming in the upcoming exam. And if we are lucky enough, you can like get some 4 or 5 questions also from this one. And for more things, there's a video with the name of 10 important topics for the ENT, so you can watch that also, and in that like all the important things which you must know have been covered. Okay, so thank you so much for watching this video. All the best for the exam. I am Dr. Padmini, your mentor for the FMG.